Hello. In our July online seminar, I provided an overview of how the theme of care, paid and unpaid, featured across the public submissions. In this video, you will see an excerpt from that July video that gives an overview of the problems and solutions identified on the theme of care. At the end of that excerpt, I will return to focus on dimensions of care that were more frequently emphasized in the submissions. I will take a particular look at early years care, disability and elder care. And I will emphasize submissions that made a connection between the undervaluing of care that affected both caregivers and care receivers in ways that reproduced gender inequality. A broad sentiment across the public submissions from organisations and individuals was that care is fundamental to all human activity, but responsibility for it is unevenly distributed across society. And a number of submissions, notably, argued for the importance of supporting men's role as carers.
Problems identified on the specific theme of care. These included that women are overrepresented in care work, paid and unpaid, that care work is largely unrecognised and undervalued, that men are disincentivised from providing care and lose out on the rewards of care, that a lack of affordable and accessible childcare and quality home care limits women's opportunities at work and in public life, that a lack of flexibility in parental leave, a lack of choice and support for a range of childcare options makes sharing care difficult, and that workplace culture and practice is often incompatible with the provision of care. Submissions also identified a range of solutions to these problems. These included tackling gender stereotypes through education by showing male carer role models, promoting care as a public good, increasing the pay and status of care workers, extending and sharing parental leave and supporting men and men's groups, providing public regulated quality well-being care across the life course, supporting carers in the home to care with excellent services and adequate payments, and more flexible work and parental leave. What follows now are a series of examples of excerpted quotes from the public submissions that use the problem and solution responsibility format. We've organised these under headings A to D. The A, problem, assumptions about what care is and who should care. Submissions in their own words state, the care system has to stop working on the presumption that there is a woman who is expendable from the workforce who can take on most of the work. By not providing the support structure, the state is in a way promoting the stereotyping of women as homemakers. Solutions offered to this included messages on how we raise boys and girls about who's responsible for care, and promoting men in carer role models. This includes the statement, men should be featured in caring roles in schools, books, movies and TV programmes. Problem B relates to the lack of value placed on care, paid and unpaid, communicated in comments such as, society only puts a value on paid work. Care work is needed, carried out by women and not valued by society. It is work that is only noticed when it's not done. The consequences of a life of unpaid care was apparent in this comment. 40 years ago, I gave up work to look after family members. There was no carers allowance. But little did I know that it would still affect my finances when I'm a pensioner. This is just another anomaly, only affecting women, as we did most of the caring. Solutions for valuing caring centred on understanding it as a public good. This is captured in the comment, state needs to put a cost on caring and support it appropriately. This means higher taxes to support carers and care workers. Problem C relates to the cost, affordability and access to care. And the lack of affordable and accessible care here is seen as a specific barrier for women who work. Communicated here. Childcare is incredibly inaccessible and overpriced in this country. Anecdotally, I know a few women who had to give up work entirely because it isn't possible to get childcare. Submissions also stress that for working parents, for lone parents, especially poor migrant and traveller women, accessing care was very, very difficult. The solutions included that the state was responsible to recognise, regulate and fund quality, affordable care and to support carers in the home. This is captured in the comment, where families do not avail of childcare, the person caring for them in the home should receive state payment. Small number of submissions detailed how custody arrangements had made it difficult for fathers to care for their children as much as they would like. Problem D related to work and care as incompatible. Many of the submissions focused on the idea that an ideal employee is expected to be available for work regardless of care responsibilities. This is captured in the statement. In practice, women who have child-rearing responsibilities often take the lower paid position to facilitate what is in reality a second full-time job. The barrier is flexibility. Although many employers would say they support flexible working arrangements for working parents, in reality they don't appreciate the added demands that having a full-time career and a family brings. Solutions focused on work that facilitates care. This is captured in the statement. Greater parental leave, standardised flexible working policies for parents. Overall, for many submissions, addressing the unequal care burden required a broad yet integrated solution, summed up by the state has a role to play in encouraging more males to avail of family-friendly work patterns. The education system has a role to play in breaking down stereotypes. Private and public sector have a role to play in advancing availability of family-friendly work practices.
I now return to discuss a number of issues that were emphasised in the submissions on care, and they were considered significant for further analysis. Problem E, childcare costs impact severely on women's working and personal lives. In this submission, our childcare system is under-resourced, poorly regulated, widely recognised as being a significant barrier to greater labour force participation by women as households can't afford the fees. In another submission, the Irish childcare system is broken. Childcare fees are the highest in the EU, while 60% of employees in the childcare sector, almost all women, earn below the living wage of €12.30 per hour. Solutions advanced to problem E included, I think the best system is childcare provided by the state, as in Scandinavian models. For another, increase investment in early years to 1% of GDP, as recommended by UNICEF over the next decade. Problem F, caregivers are poorly supported and their work is often invisible. In this submission, family carers are more likely to live in poverty, with many family carers experiencing a sharp decrease in their earning ability, perhaps needing to give up work entirely, as well as bearing the cost of caring. Female carers provide more hours of care at the higher intensities of care. Male carers may experience stigma and have fewer support networks. For another submission, if all family carers decided to stop all the care work they do, what would the state do? They rely on people looking after their family, all with little recognition, support, or allowances. A solution advanced to deal with problem F included, recognise carers' vital social employment and pay carers for the value of the work done on behalf of the state. Problem G, care receivers often lack choices in the care they receive. For this submission, the absence of a sufficient state response to supporting people with disabilities to live independent, supported lives forces disabled women into a position of dependence on family members. This leaves family carers predominantly to provide often very high levels of care. Solutions. The full implementation of international law to better support disabled women's autonomy and choice to care. Provide a statutory right to home care to support older persons and personal assistance service for disabled people so that the cared for can remain independent. Problem H made a connection between inadequate care infrastructure for older people and people with disabilities, and for some people who receive care, a lack of dignity and autonomy in the care that was available to them. A lack of access to home care for older people and wraparound support services available on a consistent and fair basis across the country increases the pressure on families. The lack of supports by the state for disabled women create unnecessary vulnerabilities. The solution forwarded and details here in this excerpt makes a connection between an inadequate care infrastructure for care receivers and a burden of unpaid care work on women. Improving the suitability of and confidence in social supports and services for disabled women would improve the circumstances, health and well-being of all women in unpaid care roles. Suitable transport, employment, personal assistance hours, accessible and supported housing options for disabled women and disabled men would increase their economic security, social connections and safety, and in turn reduce the need for non-disabled women to provide unpaid support. This final excerpt from a submission sums up a common theme across many of the solutions put forward across individual and organisational submissions. Ireland's level of unmet need for care services is among the highest in Europe. A comprehensive and inclusive care system would give recognition to the valuable work done by thousands of women and men every day in Ireland. It would invite men to take on more responsibility and enjoy the often rewarding work of care. It would extend the definition of care to include care outside the home and in the community, and would confirm that the state will seek to support carers.